Welcome back, our fans. Oral considerations related to COVID-19, post-COVID-19 and vaccines of COVID-19. Coronavirus disease 2019, COVID-19, is transmitted by droplets and direct contact with infected individuals or contaminated surfaces. The causative virus, SARS-CoV-2, has on its surface angiotensin-converting enzyme 2, ACE2, binding proteins. General manifestations. 1. It binds to ACE2 receptors on the cells of the lungs. A. Mild cases, fever, cough and fatigue. B. Severe, obstruction of airways, pneumonia, cytokine storm syndrome and acute respiratory distress. 2. It stops the action of renin-angiotensin system, causing vascular inflammation and thrombosis. 3. Involves many body systems, lungs, gut, liver, blood vessels, heart, nervous system and kidneys. Oral manifestations. Symptoms generally resolve with the resolution of the viral infection. 1. Early symptoms. Middle. Symptoms appear before or early after start of the respiratory symptoms. Middle. It is caused by the direct effect of the virus binding to ACE2 receptors in the oral cavity. Middle. The cells react by activation of inflammatory reaction in the form of inflammatory cytokine release and infiltration of immune cells. The virus binds to receptors on A. Periodontal tissues. Middle. Desquamative gingivitis. Middle. Necrotizing gingivitis and halitosis. A. Oral mucosa, buccal mucosa and tongue. Middle. Aphthous-like ulcers and other oral ulcers. Middle. Erythema multiforme like erythematous lesions and erosions on lip and buccal mucosa, and vesicles. B. Salivary glands. Middle. Sialadenitis, acute parotitis. Middle. Inflammation of Wharton's duct papilla. Middle. Xerostomia, very common symptom. 1. Late symptoms, caused by A. Side effects of drugs. Middle. Late ulcerations, aphthous-like, herpetiform ulcers. Middle. Immune suppression. O. Candidosis. O. Deep fungal infections, mucormycosis. O. Herpes simplex virus reactivation, recurrent intraoral herpes, RIOH. O. Exacerbation of autoimmune disorders, OLP, EM, SLE. Middle. Angina bullosa on the palate and tongue. Middle. Anticoagulants, spontaneous oral hemorrhage. Middle. Urticaria and angioedema. B. Iatrogenic effects of intubation, traumatic ulcers. C. Secondary to the systemic inflammation caused by cytokine storm syndrome, ulcers and mucositis. D. Psychological burden of the disease, oral ulcers. E. Some oral lesions are coincidental or pre-existing as geographic tongue or fissured tongue. Treatment of oral symptoms. A. Aphthous-like ulcers, treated by topical or systemic corticosteroids. B. Candidiosis, treated by nystatin suspension, 10,000 IU. C. Recurrent intraoral herpes, on the palate, treated by systemic acyclovir or valacyclovir and local anesthetic. D. Necrotizing gingivitis and halitosis. Treated by Middle. 400 mg metronidazole 3 times/day for 5 days. Middle. Chlorhexidine 0.12% mouthwash 2 times/day for 10 days. Special symptoms. 1. Taste and smell disturbance, gustatory and olfactory dysfunction. Starts few days after infection and extends up to 14 days, hypojusia, dysgeusia, or agusia. The most common symptom. Caused by either A. Virus damages the taste buds. B. Virus infect the nerves responsible for the taste. C. Lower salivary flow affects taste. D. Altered taste secondary to altered smell. E. Increased use of oral disinfectants to prevent secondary infection cause injury to the taste buds. F. Zinc deficiency. A. Drug-induced. 2. Pain and burning mouth syndrome. A. Tongue depapillation. B. Xerostomia. 3. Hedechiaea. A. Thrombocytopenia. B. Thrombotic vasculopathy. C. Drug-induced thrombocytopenia. Thanks for watching. Support us by likes and subscribes.